Hi there, curious minds. Let's do something together real quick. Take a deep breath in and out. Feels good, right? But what if every breath you took felt like breathing through a straw? That's what it's like for people who suffer from respiratory diseases, a super important topic in clinical medicine. In this video, we're going to explore what these diseases are, why they matter so much, and how doctors, nurses, and scientists work every day to help people breathe easier and live longer. What is the respiratory system? Your lungs are like giant balloons inside your chest. Their job is to take in oxygen, the fuel your body needs, and breathe out carbon dioxide, the waste gas. The air travels through your nose, down the windpipe, called the trachea, through bronchial tubes, and into tiny air sacs in your lungs, called alveoli. Now imagine if this system gets blocked, inflamed, or filled with mucus. It becomes hard or even painful to breathe. That's when respiratory diseases strike. Common respiratory diseases you'll study. Here are some of the biggest topics you'll explore under this subject. Asthma, a condition where the airways tighten and swell, making it hard to breathe, especially during exercise or around dust and smoke. Chronic obstructive pulmonary disease, COPD, usually caused by smoking. This disease slowly damages the lungs, making it tough to breathe all the time. Pneumonia, an infection that fills your lungs with fluid and makes you cough, feel weak, and sometimes have a fever. Tuberculosis, TB, a contagious infection that attacks the lungs, still common in many parts of the world. COVID-19, a recent global example. This virus attacked the respiratory system and showed the world just how vital lung health really is. Lung cancer, one of the deadliest cancers, often linked to smoking and pollution. Real-life example. A trip to the ER. Let's say a little girl comes to the emergency room wheezing and struggling to breathe. Doctors quickly realize she's having an asthma attack. They give her a bronchodilator, a special medicine through an inhaler, and suddenly her breathing becomes easier. That small action, guided by knowledge of respiratory diseases, just saved her life. How is this knowledge used in real life? Doctors and nurses use this knowledge to diagnose patients using stethoscopes, chest x-rays, and lung tests, treat patients with inhalers, oxygen therapy, and even surgery, prevent disease through vaccines, public health education, and clean air policies. Researchers also study how air pollution, climate change, smoking, and viruses affect our lungs and invent better ways to protect them. Why should students learn about respiratory diseases? Because breathing is life, and helping people breathe is one of the most important things in medicine. Whether you're training to be a doctor, a nurse, a medical researcher, or you just love understanding how the body works, this topic teaches you how fragile and powerful our lungs are, how to handle emergencies with calm and skill, and how small actions, like quitting smoking or wearing a mask, can save lives. Closing, every breath matters. So the next time you take a breath, remember, your lungs are working hard for you, and the people who study respiratory diseases, they're the heroes of the breath, making sure our lungs keep us going, one breath at a time. Stick around for more exciting videos as we explore the amazing world of medicine together. Until next time, keep breathing, keep learning.